1 in 5 children who leave our emergency department today will not know where their next meal is coming from. It's an alarming statistic. In case you didn't catch it, let me repeat that one more time. 1 in 5 children that leave our emergency department after getting care today will not know where their next meal is coming from. As parents and caregivers, we simply cannot tolerate and accept that anymore. Today, we're here to take another step in making a difference in children's lives. I'm Senior Vice President and Chief Operating Officer David Berry, and on behalf of us all here at Arkansas Children's Hospital and the Natural Wonders Partnership Council, thank you for joining us today and for being with us. Let me take a moment to recognize our speakers today. Off to my left, and they'll each be joining me here at the podium in a few minutes, Dr. Pat Casey, who is the Harvey and Bernice Jones Professor of Developmental Pediatrics and the Vice Chairman for Faculty Affairs for the Department of Pediatrics in the College of Medicine at UAMS and at Arkansas Children's Hospital. Joining us also today is Larry Crutchfield, the State SNAP Manager with the Arkansas Department of Human Services. We also have Kathy Webb, the Executive Director of the Arkansas Hunger Relief Alliance and the No Kid Hungry campaign. And we have Jennifer Ferguson, the Deputy Director of the Arkansas Advocates for Children and Families. Arkansas Children's Hospital has known for some time that food insecurity is a growing problem facing the children of Arkansas. We work with children and families from across the natural state and are uniquely positioned to see how hunger makes life harder for these families and the strain that it places on parents as they try to figure out how they will feed themselves and their children. We typically ask, "What's for dinner?" These children ask, "Will we eat tonight?" Through our Natural Wonders Partnership and with the shared vision to improve the health of Arkansas's kids, we work with over 30 organizations and groups to address this and other challenges facing the children of our state. Our partnership with our staff, our medical staff, the Arkansas Department of Human Services, and the Arkansas Hunger Relief Alliance has resulted in a new opportunity to match food resources with families in need. The ability of families using our clinical services here at Arkansas Children's Hospital to register for the USDA Supplemental Nutrition Assistance Program, formerly known as food stamps, now known as SNAP, while they're on our campus, while they're receiving care, is one more way that we can help reduce barriers to our children getting the food they need. We're so pleased to be part of this effort. And now please welcome our champion of this effort here on our campus, Dr. Pat Casey.
Thank you, David. And thanks to everybody for being here today, and particularly thanks to our partners in this effort who will all have an opportunity to speak with you. To repeat, 1 in 5, 20%. As a symbol of that, we have over on the table here 5 boxes, lunch boxes, 4 of which are filled with food, and 1 of which is essentially empty. We use that as a symbol, if you would imagine a family at home with an empty cupboard at mealtime, as a striking reflection of food insecurity. The background on this and how we got into this is that I've been a member of an organization we call Children's Health Watch, which is a group of pediatricians like myself, people located at academic institutions who run clinics for children who are undernourished. And for the last 15 years or so, we've been performing interviews in the emergency departments of our individual sites. Over those years, we've interviewed more than 40,000 families. In Little Rock here at Arkansas Children's Hospital, we've interviewed over the years approximately 10,000 families. One of the issues that we get at in our interviews is this notion of food insecurity. For those of you who are not familiar with that notion, it's an effort to understand whether a family has access to a stable and adequate diet over time. People sometimes use the word hungry. We use food insecurity because we collect this in a survey and we have no way to measure true hunger. The survey is 18 questions that gets at whether a family has enough food for money, whether they actually have to start scrimping at meal times, in fact, whether they skip meals. And one of the questions is, did your child not have a meal for an entire day? Very striking questions. And from that, we get to this notion of food insecurity. Our research and research from others has documented that food insecurity is known to be associated with poor child health, more hospitalizations at children's hospitals, a greater risk for developmental problem, and even something as concrete as iron deficiency anemia. One of the other notions that we measure in our interview is access to SNAP. Supplemental Nutrition Assistance Program. This is a federal program that formerly was called food stamps, which helps families obtain food as they try to feed their children. Our research and research by others has demonstrated that SNAP does improve the health of children and does improve their access to food. Because of this striking number, this 20% in our emergency department, we felt that we at Children's needed to do something. For the last several months, we've been meeting and plotting with my colleagues, trying to determine what steps, what action steps we might take to try to impact this 20%. And today we're proud to announce that as of now, we are able to take applications to SNAP through the financial counselors at our hospital, who will then work in interaction with the local county officials to hopefully facilitate access to SNAP. We're really pleased and proud with the cooperation we've had from the Department of Human Services and the Arkansas Hunger Alliance, and we're really hopeful that that effort will somehow impact this 1 in 5. I'm now pleased to introduce Mr. Larry Crutchfield, who is the manager of the SNAP program at Arkansas.
Thank you, Dr. Casey, and the Natural Wonders Partnership Council for allowing me to be here today. I share the concern of others here regarding the number of food insecure children identified by the CSNAP assessment tool. To assist in addressing this issue, DHS and Children's Hospital are being proactive. The DHS Children's Hospital outreach effort includes the following measures. Number one, we're providing multi-program paper applications to Children's Hospital that will allow families to apply for SNAP as they leave the hospital. We're providing training and technical support to Children's Hospital staff regarding the handling and the routing of applications. Children's Hospital has public access computer workstations in designated areas that can access the DHS online application portal. And DHS will provide a SNAP mobile enrollment unit on site at regular times each month as part of this effort. This effort and its associated activities will be evaluated and adjusted as necessary. We will work with Children's Hospital to provide the best opportunity for success in this initiative.
Thank you, Larry. And now please join me in welcoming the Executive Director of the Arkansas Hunger Relief Alliance and the No Kid Hungry campaign, Ms. Kathy Webb.
Thank you. It is a real pleasure to be here today and to be here with so many of our partners in the fight to end childhood hunger in Arkansas. As Executive Director of the Arkansas Hunger Relief Alliance and partner in the No Kid Hungry campaign for Arkansas, we took a trip recently to Texarkana to a summer feeding site. One of our staff members was having lunch with a little girl who was 8 years old, and as she tried to engage that little girl in conversation, one of the questions she asked was, "How do you like your lunch?" The response from the 8-year-old girl was, "I'm so happy to have a meal." I'm so happy to have a meal, an 8-year-old girl right in our own state. Now, that's just wrong. An 8-year-old shouldn't be thinking about where her next meal is going to come from. She should hopefully be thinking about playing and about spending time with her friends and about other activities, but not where is my next meal going to come from. The Arkansas Hunger Relief Alliance and the No Kid Hungry campaign work in a collaborative way with DHS, with the governor's office, and with other organizations like Arkansas Children's Hospital to match resources with the people who need these resources through SNAP, through summer feeding programs, through after school, and through breakfast. It is a true collaborative effort, and in my opinion, the only way we will be able to reach our goal of ending childhood hunger in Arkansas by 2015. This step today and other steps that Children's Hospital are taking will be a huge effort towards achieving that goal. Thank you very much.
Thanks, Kathy. And now join us will be the Deputy Director of Arkansas Advocates for Children and Families, Jennifer Ferguson. Jennifer.
Thank you. Good morning. Arkansas Advocates works with Children's Hospital through the Natural Wonders Project, and we're so excited that they're taking on this initiative to address childhood hunger and nutrition in this state. As most of you know, over a quarter of our kids in this state live in poverty, and if you're under 5, that number is even higher. And Arkansas Children's Hospital comes in contact with some of these families that are just struggling to get by. Not only are they taking care of a sick child, but not only is this family trying to take care of a sick child, but they're also trying just to make their daily needs be met. And so initiatives like this help take just a little bit of the burden off that family by helping them access programs easier, such as SNAP. As Dr. Casey has said, SNAP not only addresses the child's physical needs, but also early childhood development, which is critical for a child's learning and for them to be prepared for school. We hope that other organizations and institutions will follow Children's Hospital's lead and come up with creative solutions with working with the Department of Human Services and the Hunger Alliance to try and address childhood hunger and nutrition in this state. Thank you.
Thank you, Jennifer, and to all of our partners that are going to make such a difference, we hope, in making food available to kids and their families. At this time, we'll be happy to take any questions, or we'll be available afterwards if you'd like to do something one-on-one. We're happy to do that as well. We thank you for coming and trust that you'll help us in getting the word out that we have SNAP, the process of making SNAP applications available here at campus, and that Arkansas Children's Hospital, along with so many others, now really want to make and begin and continue to make real efforts in improving and lessening hunger with our kids and their families. Thank you so much.